Hi everyone. Hope you're all doing well. Uh, Thank you again for working with me on not being around. You all did really well. We'll talk more about it on anatomy and physiology. I definitely want to have like a debrief, if that's okay with everyone. Both a like a general debrief, it shouldn't be too long. Um, as well as uh, about the course, what worked, what didn't, um, and then also individually, especially because I'm going to be working with you on the NCLEX. I know it's a ways away, but time flies, but also for me on my end, I'm always, thinking about that test and trying to frame things to make that time uh, as seamless as possible so that when you get to the NCLEX review, it's not as shocking, the material. And so to do that, I want to make sure that for each of you, you're a little bit different. Um, and maybe timing or the resources you use or whatever it is. I want to kind of get a better picture, if that's okay. And we've talked about this a little bit in class, but we'll talk about it more uh, uh, on our next class, which is next Thursday, or this coming Thursday, and it's in the email as well. But anyway, let's jump in. This is the basics of pharmacology. I would suggest that either you watch this and then read, or you read and then watch this. It is important for this stuff, even more so than anatomy and physiology because of the terminology. It is pretty much its own language. So when we're talking about diuretics, when we're talking about ACE inhibitors, when we're talking about, I mean, this is the beginning, but when we're talking about different classes of drugs, and then we're talking about specific drugs like enalapril or captopril, or Lasix, generic versus brand, um, again, this stuff isn't, this is very much, is not crammable. And on the flip side, it is so much easier. And this is something I do want to talk with each of you about, not to say the same thing again. I know I've said this before, but individually to see what the reality is of how you can fit in your life, 10, 15 minutes and what makes the most sense. Again, remember, my background mostly has been in tutoring, so like one-on-one. Maybe I've had a few instances where it's been maybe two or three students, but I've had hundreds of students, and I want to integrate that skill set into what I think I can bring to the table for each of you because this isn't a class of 300 people. So we can really sit down and kind of hash that out. And in doing that and spending 10, 15 minutes, doesn't have to be a day, can be every other day, whatever it is, you really will make your life a lot easier when studying for the NCLEX, and the information will have time to settle in your mind, is another important aspect of this stuff. Otherwise, uh, uh, it will be just a bunch of memorization, and that's why a lot of people fail. The people who fail the NCLEX, that's why they fail, typically. And that's true for most standardized exams. Is instead of spreading it out, and this is an accelerated course, but there's still right now there's still plenty of time, but I don't want it to be a year from now and us go, oh well, I wish I had spent more time. So anyway, that's my soapbox. We'll talk more about it. Um, so this is pharmacology, so study of drugs. Um, it's clear and simple, or that's the book, as clear and simple as it can be. Um, and for this also, so now I'm transitioning into, even though the slide isn't changing, I'm transitioning into talking about like the course, this course. Uh, this and medical terminology, but there will be a lot more use of Quizlet, which I think you'll be happy about. But uh, there, it is going to be uh, a lot of, like I said, new terms for everyone. So again, going through those Quizlets, it's not going to in general, I would assume it's not going to be a one-time over review of the Quizlet and you're good. So we'll work together. We'll get through this, and yeah. So let's get started on chapter two, which is what this is really about. This lecture. All right. So what we're gonna do is we're gonna talk about some key terms, and in this, and then we're gonna list the four steps of the drug cycle, their effects on the body. So just to relate it to something we've talked about recently is like in the GI tract, in the gastrointestinal tract or the digestive system. Um, uh, we talked about like the difference between digestion and absorption, um, and how like in our common speech we just think of them as uh, kind of the same thing, I think. Uh, you know, but they are two different things. Digestion is breaking something down into smaller and smaller particles. Absorption is actually pulling the nutrients into your body, right? Well, we break down taking a pill and it being used by the body into four steps that are very important, that you need to know, um, and we'll talk about how that works. So it's not just take pill, pill works, right? That would be, I guess, two steps, but there's more to it. So we'll talk about the therapeutic level and the potency of the drug. Short version is the therapeutic level is the level in your blood that or yeah, the level of drug in your blood, which has what we call a therapeutic effect. So if you're taking a blood pressure medication that's supposed to lower your blood pressure, there's a certain level of that medication, uh, that actual chemical that needs to be in your blood in order to work, and that's the therapeutic level. The potency is kind of like the is how strong a drug is. So yeah, and then we'll talk about how drugs. Again, this is all on a broad level, so we're trying to set a foundation. Describe how drugs can interact. Um, uh, Differentiate between a side effect and an adverse reaction, which is important. Compare and contrast the usefulness of different drug resources. So that's a little bit different than the other ones, right? But it falls under the category of this like overall, this basics of pharmacology, because you need to know these drug resources, and these are drug resources that you're going to be using throughout your careers. And it really is, I mean, from a nursing level, it's what differentiates like a great nurse from a good nurse. But you have to at least be aware of them. Um, so, so these are the key terms. I'm not going to go through these in this lecture. Uh, I may have a separate lecture that goes through these, but what I will do is that I'm going to put these on the Quizlet today. So uh, you'll get an update via email going through each of these. These are, very well kind of lined out or defined within the book. But yeah, I'm not going to go through each of them right now because this would be just like a bunch of different ideas, uh, all thrown together. right at the beginning, but instead we'll kind of ease our way into these key terms. So I think, like, again, that's why kind of reading, understanding the context of everything, and then going back to the key terms, to me, logically, and the way memory works, or remembering, or thinking about things works. So you have to build a foundation first before I can talk about agonists and antagonists and biotransformation. Right now, uh, this is a lot to absorb, but I'll send you an email and have these out for you, and we'll go from there. But okay, so now getting into the meat of it, you know, what is pharmacology? So we're, again, remember, we're building this foundation for pharmacology. Um, it's the exploration of substances used to heal, comfort the sick, help us live longer, help us live healthier lives. So first, pharmacologists, they used maggots. Actually, maggots, we can talk about in class if anybody has questions, but maggots actually have had a comeback. So they were originally used because they had some, they clean up wounds. Necrotic means dead, or dead tissue. So usually it's, I mean, maggots they use for dead skin, usually. And then poisonous foxglove. They're talking about, if anybody is aware of a drug called digitalis or digoxin. Um, that's what they're referring to. If you don't know, that's fine. We're not there yet. But it's for heart failure. A lot of medications actually, are came from, or I should say a lot. Some medications came from poisons. A poison, so like a poison in low dose, certain poisons in low doses, before they can cause the effects that lead to death, actually have some interesting effects on the body. For poisonous foxglove, digitalis, um, the chemical, the poison, um, is causes the heart to speed up, or it causes it to contract almost too strongly in its poisonous form. But if we tone down the dose that we give, not the poison dose, but like the dose you would get from the actual plant, but a lower level of that poison, it actually is useful. And so they've synthesized a drug based on that poison. And this happens all the time, whether it's synthetic, whether it started as a poison and we still use a version of that, just uh, like synthesized, or uh, uh, kind of made uh, uh, in a lab, or whether we make it completely synthetically. So we make it just in a petri dish or whatever it is. So whether we're harnessing the actual poison, or we're making a drug that looks like that poison because we know that that will work for a disease. Um, like some of the more, the most straightforward one that I think, I'm going to reference, is the idea of like an antibiotic. So don't worry about specifics of antibiotics, but antibiotics help our immune system, but they fight off infection. So, uh, the and I think this kind of frames both pharmacology and how we think about it, but it also will help you gain perspective on how people view the healthcare system in a broader sense, which we will talk about as we move forward. But you would, with an antibiotic, it's very simple. It's simple in theory. You have an infection, you go to the doctor, they give you an antibiotic, and then you're treated. The antibiotic helps kill the bacteria, and then you're treated, right? uh, and then you're done. You take a 14-day course or whatever it is, a 7-day course of antibiotics. Um, the differences these days, that we are treating, just to kind of start the conversation, um, is that we are treating more and more illnesses that are not that, in healthcare. We are treating chronic illnesses, so illnesses that you don't just take a drug, go home and you're done. Um, so things, again, a good example is diabetes. So you don't just take one shot of insulin and you're cured of diabetes. So anyway, but anyway, all these, pharmacology, our job, the job of drugs is to help heal or to help comfort in terms of like pain medication. It does help us live longer. Again, antibiotics are a good example of that. Um, and there are others as well. And then healthier lives. So quality of life is an important aspect. All right, so these are the four phases. So this may take a few run throughs for when you're going through when you're reading about it, and we'll talk about it. But the four phases are shortly known as ADME, ADME. So uh, the ADME. If somebody says ADME, 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 they're talking about this. Uh, and so the four phases are absorption. Uh, so that is so you take the pill. We're gonna assume, by the way, it's an oral pill. So just assume it's not IV, intravenous, which we'll talk about later. But it is an oral pill. You take it, it gets absorbed into the blood. So remember, this is a pill capsule. It's filled with let's say a powder, which is basically a bunch of chemicals, millions or billions of copies of a chemical. So you're taking like an aspirin or something. It's just that the chemical name is acetyl salicylic acid. Don't worry about that right now, but it's just a bunch of those repeated over and over again, and then that's what gives you the dose. How packed full of that chemical this is. You put it into your body, and then at some point, whether it's in your stomach or your small intestine, or your large intestine, rarely, um, that you absorb it, uh, in this as the GI mucosa, gastrointestinal mucosa, and really what it's being absorbed into is your blood. So I would say, and blood. Um, the second phase is distribution. So once it's in the blood, like we talked about in vascular, cardiovascular, and circulatory, is that the medication is then transported through the circulatory system. Uh, uh, it's transported throughout the body. So I want to start there. Uh, your circulatory system goes throughout the body, right? It doesn't differentiate where it's going. The the goal though is like that it will if it's let's say an antibiotic, I'll just throw out like amoxicillin, if you've heard of that, but let's say penicillin, penicillin, and let's say you have an infection, um, in your uh, you have a skin infection on on your right arm, so on this person, so the chemical is circulating throughout the blood, but it it will act at the point of infection. Everywhere else, it will just be circulating in the blood, and there will be no purpose to it, right? In terms of helping you. You have an infection here. It will work on that infection and work outward within the blood stream, and it will also, depending on the drug, it will permeate. Meaning it will go through the blood vessel and go to the actual source of infection. Some drugs do this, some stay within the blood completely. But either way, in this case, it will fight off the infection, right? And that's what this is saying, to the point of action. It's showing you the pills, although please don't think that the actual pill is in your blood. The pill, it gets dissolved in your gut. That this is just a gelatin. It's like a gel capsule, and so it dissolves very easily in the gut, and then those chemicals cross. The powder crosses through into the bloodstream. But they're just trying to show uh, the uh, the drug distributing within the blood. And then, so it's working on that, right? And then the medication at some point will go through the liver. And I know that uh, I've talked about this a couple of different ways, a couple different times, and that the liver it does a bunch of different things. The other thing I said though that's related to this is that uh, the liver is involved in detoxifying, um, and so metabolism for this uh, usually involves the liver, or it always involves the liver, but sometimes it can involve other parts of the body as well. So the liver will, as it's circulating in the blood, the blood is passing through the liver. But when the drug gets to the liver has specific enzymes, which we'll talk about later, that will take that drug and it can do different things with it. But let's just say, for simplicity, it deactivates it, meaning it takes that drug and turns it in, it changes that chemical of penicillin into a form that's no longer active, and it no longer works, and now it can be, let's say, peed out, right? So that would be the next step, which is excretion. So then the leftover, the penicillin that's been deactivated, can travel to the kidneys, where it'll go through the process like we saw in urinary, where it will be peed out. So um, uh, the there are definitely more steps to this, but to keep it simple, right? You ingest a pill. Then sometimes people keep ingestion as like IADME, but you will always see this as ADME, like in general when you talk to people. So ADME is the are the steps. But there's some form of ingestion, or bringing the drug into the body. Then there's absorption into the blood, uh, across the stomach, or across the small intestine or the large intestine. Um, and then it's transported throughout the circulatory system and will act where it is supposed to. Um, and then your liver will uh, metabolize it. And in this example, I'm telling you that it deactivates it, which is most commonly the way we think about the liver, although there are exceptions to this that we'll have to discuss. And then has to be excreted, so you have to pee it out. So that's why, again, you don't just take, generally, you don't just take one pill once and that's it, right? You have to take a pill, and then you have to you have to take, let's say, 2 times a day for 7 days or something, because your body is using that chemical is being used to fight that infection, but it's also being degraded or deactivated by your liver, and then you pee it out. So you have to replenish the levels of that drug in your system, and so this is the drug cycle. Um, all right. So, so factors influencing the drug cycle, there are many. The drug itself, but just to touch on a few, the drug itself. So, there are some that take longer to break down. So, uh, we can talk about that in terms of uh, either absorption. So some drugs will sit in the stomach for longer, is one way. I think they don't mean it this way, but I want to bring it up. Uh, so one way is that it can sit in the stomach for longer and take longer to absorb uh, into the into the body. So that's one way reason you might see drugs that take 2 to 4 hours or 48 hours 4 to 8 hours to have an effect versus drugs that take like 2 minutes, right? Because there's this digestive process that has to happen to allow the chemical to get across, and that can depend on a lot of things. That can depend on like the type, the version of pill that you're taking. So that's one thing. The other thing that is being referenced is that when it's circulating within the blood, uh, the liver, for different drugs or different chemicals, it has different rates that it breaks that stuff down. So uh, some drugs will sit at in the blood for a lot longer, uh, for longer periods of time, and that for if the liver is slower at breaking those drugs down into an inactive form, and that's important for um, dosing. So meaning the how often you have to take something. So if something is sitting at the level you need it to in the blood um, for a longer period of time in order to be active, and then you don't have to take it as often, right? If I have drug A and it's circulating throughout the blood and it stays in the blood, isn't being metabolized by the liver uh, quickly, and it's just floating around and being and doing its job, and it doesn't really get degraded by the liver till 48 hours, 72 hours, like 3 days, 4 days, 5 days. Then you don't have to take it for every day. Maybe you take it every couple days, right? Versus a drug that, and every drug is different. Drug B goes to the liver immediately. So after maybe an hour or even after like 30 minutes after absorbing it, that it goes straight to the liver, or I shouldn't say straight to, but it goes through the blood and the liver gets to it very quickly within 30 minutes. And that means that the drug lasts, let's say, like 2 or 3 hours, right? That means that maybe you have to take it every 4 hours instead of, the other drug A where you had to take it every 3, 4, 5 days, right? So the rate that the liver takes to break down a drug is important in dosing, which is, again, how often you take it. Um, Route of administration, taken by mouth versus taken direct injection into the circulatory system. So PO is by mouth, and through the circulatory system we put IV, which stands for intravenous. Um, and uh, yeah, I mean, by mouth is slower than intravenous. So, that's okay. Uh, uh, we don't always want to give drugs IV. It's also a lot easier to give a person a drug by mouth. Imagine, you know, people who are on 10, 15 drugs, and imagine if they were all IV, right? We'd have to give them 15 injections IV every day, right? That doesn't make sense. And then also, like the speed is uh, we have more layers we can work with here to um, modify the speed that the drug gets into the system if we give it by mouth versus if we give it IV, it's all available to the circulatory system immediately. Whatever you injected in them is there. So you've kind of skipped a step, right? We've skipped absorption. So for IV, it basically just goes uh, distribution, metabolism, excretion. Absorption gets canceled out, right? And then the health of the patient's organs. So, again, a good example would be the liver. So, if the liver is damaged, then your ability to detoxify or deactivate the drug is lower, which means that you will build up drug more than another person who has a healthy liver, right? Um, So, absorption. So, the process of a substance moving from administration site to the bloodstream, as I said, right? Speed of absorption depends on the route or route of administration. So we can do it a number of ways. There's topical, which is means on the skin. Um, there can be issues if somebody has scars uh, uh, or tattoos. Um, Scars make uh, getting drugs into the system more difficult, and so we usually say not to put them over scars or tattoos. Um, uh, Tattoos cause a different problem, but we try to avoid. We want to put it on clean, usually dry, well, dry, not usually, all the time, dry skin. Um, and then there's systemic. So, systemic meaning that it's going to the entire body. Uh, and So we have oral and intravenous and injection. So this could be subcutaneous or intramuscular, where you inject straight into the muscle. But all of these are getting into the systemic circulation, into the bloodstream. The topical are only affecting the surface of the skin, right? Whoops. Sorry about that. So other factors that come into play are fat solubility, pH, uh, and obviously the concentration of uh, the uh, the concentration of the medication. So the more concentrated a medication is, the uh, usually the faster that it will be absorbed, right? Uh, um, the length of contact, so the amount of time that the drug is in contact with uh, either whether it's the skin or uh, or whether it's the stomach, you know, that can affect how much drug from that capsule or from a topical cream or uh, a topical patch, uh, uh, how much of that drug gets into the body. Um, the age, uh, so different ages digest things differently, and that's no the absorption is no exception for that, for drugs, I mean. With or without food is important. So some medications you want to take with food, and like they're absorbed better with food, and other medications are absorbed better without food. Um, and uh, the depth of breathing. Now, this is for different types of medication that we didn't look at yet, but things like asthma inhalers, right? So, in that case, we're absorbing into the lungs, not into the stomach. And so, if you take a deeper breath, you get more drug into your lungs, and that leads to more absorption. We're going to skip that. I'm sorry. So, distribution is the delivery of a drug to the site in need after it has been absorbed into the bloodstream. So, tissues are either permeable or non permeable. So, some drugs just can't get through to different tissues. They can only get through to some parts of the body, and that's okay. But we have to take that into account uh, when we when we give the drug out. And then barriers to distribution, we've talked about the blood-brain barrier. That's a very common one that we will continue to talk about. So, like, if you want a medication that gets through to the brain, uh, it needs to be made specifically for that. Uh, uh, but otherwise, other drugs are not going to make it across the blood-brain barrier. And if they do, um, and they're not made for it, those will be like side effects. There's also, we haven't talked about this as much, but there's a blood testicular barrier, which is obviously a barrier between the blood and the testes, and a blood placental barrier, which protects the growing fetus from uh, medications or toxins, and in this case, medications. So metabolism is also known as biotransformation. Of course, like we have to have another word for it. Biotransformation, bio just means like our body, or bio means life, but and transformation meaning that remember when you think of metabolism, the first thing I want you to think of is the liver, right? And that the liver is transforming the chemical from, again, we're just going to stick to an active drug into a less active, as it says here, or an inactive form, and that is we call a metabolite. Metabolism leads to of a drug. Uh, in our example, in the liver, leads to an inactive form of the drug known as a metabolite. Um, and it's required to break a foreign substance down. Otherwise, if you didn't have a system for metabolizing the drug into an inactive form, you would, if you were to take, every time you would take more pills, so like, if you think you're taking, okay, a pill in the morning, a pill at night, a pill in the morning, a pill at night, if there was no way to break that chemical down in your blood or to eliminate it, it would just build up in your blood. And for people who do have diseases that uh, cause that, if they have problems eliminating, so somebody who's on dialysis or somebody with liver damage or liver disease, they will have that happen. So we have to change their dosing appropriately, probably a lower dose for them. So to be more, to give the whole picture, organs responsible for metabolism include the liver, as we talked about, and then also the kidneys and intestines have a role for some drugs and in very specific ways. But for right now, if you remember anything about metabolism or an organ, remember the liver. Um, so, biotransformation is determined by the route of administration. Stomach acid may inactivate or break down certain medications. So, if uh, if a drug were to be completely inactivated by stomach acid, then we wouldn't give it uh, through orally. Um, and if that's the case, then we may have to give it a different route. So we may give it IV or intravenous, which is IV, or intramuscular, or some other route. Um, there's a name, so this is prodrugs are drugs that are administered in an inactive form, and the metabolite is desired as treatment. So I'm not going to spend a lot of time on this right now because this is a lot to throw at you uh, while we're trying to explain the like kind of the normal, most common route of drugs. Uh, but there are some drugs that we give that are not actually active, and when they pass by the liver will actually activate them. And you can ignore this whole part if it confuses you for now, and I will explain it in class and we will discuss it. Um, like the other, distribution, and most of this, absorption, distribution, elimination, they all are affected by a lot of the same things: age, genetics, disease. And so, like, I mentioned, if you have a diseased liver, it can affect it. If you're older, your liver doesn't tend to work as well, right? Um, so this I'm gonna go, or I'm gonna skip. We're gonna go over it in class. So excretion is the process by which waste products are removed from the body. Um, so again, the main one that I want you to think of to start is are the kidneys, right? Uh, there are other ways that we excrete fluids from the body, or waste from the body. Another, yeah, so that would be like the lungs, uh, uh, bile, saliva and sweat glands, and breasts also excrete small amounts. Um, and yeah, but other than that, um, I want you to focus on the kidneys. Um, so accumulation, which is, for right now, it's basically a synonym for accumulation, which you probably have heard of. To accumulate something is to build up, like build up the amount of something. Um, so this is accumulation. Or accumulation is building up of medication in the body, leading to illness. Uh, so over time, if you build up too much medication, then it gets into the territory where it's dangerous to you, uh, and that can lead to severe, side effects, and then it can lead eventually to death, because you're basically building up a chemical or toxin in your blood at an amount that is too high. Okay, so this is a good question. So, what stage of the drug cycle would be a concern in a patient who has liver failure? Would it be? I'm going to give a second to let you think about it. So, so for this one, right, we're talking about metabolism, right? C, metabolism. Remember that the liver is the primary organ of metabolism, and failure of the liver would have a major impact on drug metabolism. Um, all right, so now we're going to shift just a little bit. We're going to talk about therapeutic level. So, as that chemical from the drug, uh, uh, in that capsule, uh, gets into the blood, there is a range that is perfect. That is what we want, and that is known as the therapeutic level. Uh, and we can measure this. You can when you go to the doctor, certain drugs we check uh, directly on a regular basis, and we check the levels of them. Like lithium is a good example uh, that we check. Just if you're aware of that drug, and there are others as well. But there's a point for all drugs, whether we can measure it easily by a blood test or not. There's a point at which the drug has a maximum desired effect. So um, if it's too low, then it doesn't work. If I give you aspirin, and a normal like the lowest dose of aspirin is 81 milligrams, but if instead I made a pill and it only had 1 milligram of, of aspirin, it wouldn't do anything. Uh, it would it would go in your body, it would be deactivated, and that would be that. You'd pee it out. Um, if it's too high, then the positive effects that we're trying, the therapeutic effects that we're trying to get from the drug get kind of drowned out by all of the toxic effects that uh, that happen. So, just as examples, they have here ototoxic and nephrotoxic. Oto means ear, so like you can there's some drugs, some especially antibiotics, that can cause what we call ototoxicity, and even the wrong dose uh, of certain antibiotics by a small amount can cause permanent hearing loss, which would be ototoxicity, ear damage. Um, and then nephrotoxicity is more common, or more commonly something we focus on because that is a source of elimination, right? For most drugs, and uh, it's passing through. Nephro means kidney toxicity, and if it's passing through the kidney, then it's going to affect the kidney. But usually at the dose, the middle between this too low and too high, the Goldilocks zone. No, the middle zone here of being in the right area. Uh, uh, we don't have it doesn't hurt the kidney, um, but if it gets too high, you can damage the kidney. All right, so then we're going to talk about drug potency, which is the strength of the drug. So uh, the strength of the drug uh, is, again, drugs. I want you to think of it as a drug, which is a chemical, and every chemical, every drug has a different. It packs a different punch. Is one way a way to think about it. So some may give you like a light tap on the shoulder, and some different drugs may uh, give a bigger uh, uppercut. Um, so I don't know the boxing metaphors there. But so that's drug potency, is the punch, of the drug. Um, and then in addition, we have these new terms, I believe, for you, which are called agonist and antagonist. And if these two don't make sense to start, we will definitely be talking about them more as we move forward. But an agonist or agonists are drugs that are taken together so that the two can be more effective than either of them would be alone. So, for example, we have drugs where for lung disease, for like asthma and COPD, chronic obstructive pulmonary disease, where one drug will you will take it in, and if I'm gonna name drugs, and if you don't know them, that's fine. You can ignore it. But you take in a drug like albuterol, um, and that opens up your lungs. It opens up the airways of your lungs. Um, and then you can take other drugs into your lungs uh, that uh, that is the sole purpose of albuterol, is to open up or uh, relax the muscles in your bronchioles, in your lungs, and then after taking that, you take a second drug, which uh, will decrease inflammation of your lungs, which is another part of asthma or COPD. And so you take that after, because after your lungs are open, the tubes are open wide enough, then you can get more of that drug further down and more easily down into the depths of your lungs, into your tissues in your lungs. And that those drugs can interact with the areas of inflammation, and decrease it. Okay? And that idea is known as synergism. Okay? And we do it with lots of other drugs. That's just one example. We do it with oral drugs as well. But I like that example because I think it's a lot more accessible and easy to think about. Is opening up the lungs is step one with drug one, and then drug two is doing a different thing, but part of the same disease process is that it's decreasing inflammation in the lungs. Um, an antagonist is the opposite. So this usually happens uh, when you have to take two drugs that are doing two different things for two different systems of your body. So if you think of people who are on like 10 or 15 drugs, it just is what it is. And they're for different diseases. But unfortunately, not all drugs play together nicely, and so antagonist drugs will work against each other to for each of them to facilitate whatever they're trying to do. So if drug A is an antibiotic, uh, that's trying to fight off an infection. But if drug B is like a birth control pill, then uh, that will some antibiotics will inactivate birth control pills. So some birth control pills. So obviously they are not related in any way that we otherwise would care about. But if you have to take an antibiotic, these are things that we have to think about when prescribing an antibiotic: is does it antagonize or does it work against another drug? Because in that case, right, if you give somebody, without thinking about it, if you give somebody an antibiotic that deactivates their birth control pills, and then they get pregnant, they're going to be like, what just happened? Why did I just get pregnant? And why wasn't this taken into account? Right? So that's antagonism. Two drugs that work against each other in some way, or one works against one, or like it could be one way, or it could be both working against each other versus the agonist side. Okay, so now we're moving to side effects. Uh, Side effects are usually mild, allowing the patient to continue taking uh, the medication. Adverse is like the next level up. So those are severe side effects. Um, so in this, I do like how they kind of put it under like the umbrella of an adverse reaction is a is a type of side effect. So like things like nausea, vomiting, this is a side effect, just normal mild side effects. Some nausea, like a cough, there are lots of little side effects. Adverse reactions can be like you break out in full body hives, like a rash, and then it can go as far as you know, you have trouble breathing or things like that. Um, Topical medications have fewer side effects than systemic medications because uh, they're not absorbed into the blood. So remember, topical medications just go on the skin, and they are treating like things like, if you want to think of them, one of the more benign or simple uh, and safe quote unquote drugs, something like aloe vera, which you put on your skin for like burns, technically it's a medication, uh, but it's not gonna like mess with your heart rate, or if you put a cream on your body, right, it's not gonna mess with your heart rate, versus if you take something into your body, into your digestive tract or IV, there's a lot more potential for adverse effects. Um, Receptors, um, I'm gonna skip these last two. We can talk about these in class, uh, but um, yeah, this is more uh, Yeah, this is more to talk about in class. I'm gonna skip that as well. All right, so drug sources, resources for information are sources available to health professionals to find drug information. You can divide them into two categories. There's comprehensive, and then there's clinical. Um, and uh, the comprehensive resources are good, are great. They cover medications in depth, and are typically, although now it's a bit different, but they were only available as printed material. Um, so the uh, United States Pharmacopoeia, the National Formulary, uh, and then dispensing information, um, as well as physician's desk reference. And this is also known, I should put this is also known as the PDR for short. But clinically based resources are more user friendly. These are used all the time, like more commonly in a way, especially now with like kind of the on the go app based situation that we have in healthcare. Uh, and they are in smaller print drug handbooks, package inserts. So the package inserts are like you can find them online for any drug, uh, and they're from the FDA. Uh, but they're also just, if you've seen on drugs, on pill bottles, they're the papers that are on pill bottles. They come all folded up, and if you open them up, they're super, super thin because there's lots of information on them. And they have to be included with pill bottles, the official pill bottles, not the pill bottles you get from uh, CVS or Walgreens or whatever. And then pharmacists, we answer questions for healthcare professionals and patients. So we're somewhere between, which I actually like. We're kind of the translators uh, between, doctors and nurses, uh, and all the really healthcare care professionals and the patients. So a lot of, depending on what you're doing in pharmacy, but your job probably includes some level of what I call translation, like translating as in taking medical words and translating them into words that the patient can understand. And as an aside, that's partly why I enjoy. It's partly why I enjoy pharmacy, and then also why I enjoy teaching, because I think teaching is kind of the same idea with a twist. You're trying to figure out ways to articulate uh, different ideas uh, to different people so that they can understand it. Okay. If you want to read up on, I mean, I do want you to read up from the book, but, which of the following is an example of a comprehensive resource? Um, so I'll give you a second. And so this would be the PDR, or the physician's desk reference. Um, it includes 6 sections. It has manufacturer's index, brand and generic, classification index, product identification guide, product information section, and a catch-all section. I don't know if that's the official. It might be the official name, but anyway. So that's the end of this intro to pharmacology, the basics of pharmacology. Um, I very much, you know, push you to read the chapter and come back to this. And then there will be a Quizlet posted. I'm not sure exactly when, but I will keep you posted via uh, email as per usual. All right, I look forward to seeing you guys soon. If you have any questions, let me know. Um, and yeah, talk to you later. Thank you.